What advice do you have for young endocrine surgeons or some of these fellows now that are coming out? You said that in general surgery, they're lucky to have 8, 10, 20 endocrine operations under the belt. Some of these folks are doing endocrine fellowships. What advice do you have for whippersnapper coming out at this point?
Well, I think first of all, you have to decide two things. You have to decide a couple things. What you want to do in your career, in general terms, not specific. Where you want to live. And some of that depends on your family, and whether you know, what voice your wife or your partner has and where you live and so on, and whether you want to live in an academic community, which I think you ought to be. I think if you take the trouble to go through a specialty rotation, you ought to be committed at some level to study. Look at your work, look at your patients, try to figure out what's going on, understand the biology of the disease, write what you can, and you should have fun at it. I always told the residents that it doesn't matter how long it takes you to finish the training that you want to do to get where you want to go. What matters is that you still have fun at the age of 65 when you want to retire.
Yeah.
And I went back to my 15th college reunion, and half my classmates were bored with their jobs and drinking too much and changing wives and so on. And I think it's so important to get involved enough in a field you're doing, whatever it is, that you're still engaged when you're 65 or 70. I mean, I was 83 now, but we have our last paper coming out recently. I finally finished that. But you got to be, you got to be involved, and being involved means taking care of the patients as people, but it also means being involved intellectually with what's going on, how you can make things better, and try not to get trapped into an ideological position where everybody's got to do X, Y, or Z. But keep your practice open up, your mind open up, so you're willing to do different things. So
great advice.